The action of the nerve agents can be visualized by this simulation of the synapse or coupling point between two nerve cell endings. In normal nervous system function, an electrical impulse travels down a nerve cell to the nerve ending or end plate. At the end plate, the impulse causes the release of a chemical neurotransmitter called acetylcholine. Acetylcholine crosses the small space known as a synapse between the end plates of adjacent cells to stimulate receptor sites on the target nerve cell. The stimulated receptor site then activates the target cell. This is how impulses travel between nerve cells. If the nerve cell is at a junction with a skeletal muscle, the acetylcholine stimulates receptor sites that activate muscle cells to contract. If at a junction with smooth muscles, such as those around the small intestine, the muscles will move rhythmically. If at a junction with a gland, the glandular cells will secrete. This is how impulses are transmitted from nerve cells to end organs. Let's go back to the nerve cell synapse for a more detailed look. Once the neurotransmitter acetylcholine acts on the receptor site, it is inactivated by the enzyme acetylcholinesterase. Stimulation of the target cell stops with removal of the neurotransmitter acetylcholine. Nerve agents inhibit or block the activity of acetylcholinesterase so that it cannot function to destroy acetylcholine. As a result, the neurotransmitter acetylcholine accumulates and continues to stimulate receptor sites on the target nerve cell, muscle, or gland. The target cells continue to be stimulated long after the original impulse was transmitted. If the affected nerve is stimulating a muscle, muscles continue to contract or twitch in an uncontrolled and repetitive manner until they go into a prolonged contraction, a condition commonly referred to as tetany, and become flexibly paralyzed, that is, go limp. If the affected nerve is stimulating a gland, it will continue to secrete, resulting in excess tearing, salivation, runny nose, and accumulation of secretions in the airways. When the antidote, atripine, is administered, it blocks receptor sites from the stimulating action of the acetylcholine neurotransmitter. Secretions dry up and breathing becomes easier. However, atropine does not free up the agent-inhibited acetylcholinesterase. A second antidote, 2-PAM-chloride, restores the acetylcholinesterase enzyme by breaking the enzyme-agent bond and removing the agent molecule. The acetylcholinesterase can once again function, allowing resumption of normal nerve transmission. Convulsions stop.